Welcome to another day in the life of TLE. I went to a doctor's appointment today and I want to just talk about that and a few other things. So I'll start with this thought. I had mentioned to my doctor today that my previous doctor had told me that Brentuximab, which is the drug that I had taken in February that caused the peripheral neuropathy that I'm experiencing now, I told him that the doctor had told me a few months ago that it was okay if I didn't have a preventative chemo during the time that I waited for my lungs to heal because the Brentuximab lasts and it stays active in your actively fighting in your body for up until a year after your last infusion. And he said that that was incorrect, and he seemed pretty confident about that, and that really bothered me. It bothered me because we're now facing another couple of rounds of chemo because there is a reoccurrence, and it makes it difficult for me to trust what I'm being told at this point. Because it's like, if you can blatantly tell me that, and there have been many things that I feel like have been stated to me by someone on a team for my care that it's been inaccurate or that didn't necessarily happen, and now things that are not even true according to my new doctor. And so that really concerns me, and I guess I'm just really feeling like a complete idiot or a joke at this point because I don't know why they would say things that are not true or lead me to believe something that is not true. And to me, that says that my health is not important. It doesn't make me feel that my well-being is taken into consideration when I've been communicated so many things that just didn't pan out in the end. And so I don't really know what to do with those emotions right now. It's just really hurtful to accept that, and makes it very difficult to go into a new relationship with a new doctor with 100% confidence, because what do you believe at this point? Who do you trust at this point? What is true at this point? How do you regain confidence, among other things, as it relates to transferring your care? I like my new doctor, and he seems pretty confident and very knowledgeable about the disease as well as the methods of treatment to take to get me to transplant. And that's one of my biggest concerns, and I'm really, really wondering if I'll ever get a transplant. I know that they're saying that that's the goal and the plan, but I'm concerned at this point, and I can't really shake that concern. It's just kind of sitting on me, and that's not really good, especially going into or having to make decisions about going into a new regimen of chemo, and trusting that the process with the new doctor is going to pan out. So, yeah, I just wanted to share that because it is new, it's fresh, it's wide open, and it's my reality. I don't know how to fix it. I feel pretty hopeless in how to even approach it at this point. Yeah, it's just another sad thing that I have encountered or experienced throughout this whole experience of being sick. I did mention to my doctor that I don't want to continue to put myself through all of these treatments and continue to go on this cycle of uncertainty. And if I'm not going to be able to transplant, we need to come up with a plan or just not do any treatment at all, because ultimately I'm ending up at the same place that I started off at. That's how I feel about it. And that place is just being uncertain. And I know that's part of the process. And I know that nothing is 100% guaranteed. But I just feel like something in this process, or many things in this process, just doesn't make sense to me. And I hate that that is the case. And I hate that because it also makes it hard for me going forward. And in addition to that, it makes me want to take more control over what I'm doing and what I'm, believing and hearing. And I don't know how to necessarily make anyone accountable for the many miscommunications, or I don't know exactly who to talk to regarding having some middle place where I'm able to communicate what I need to communicate and get this reciprocation from the doctors that I was previously dealing with. And these are all things from the past at this point, because I've been seeing a new doctor for a couple of weeks now, and he doesn't, have anything to do with that. But I still have this residue from my old experience, and I don't know exactly what to do with it, and I don't know how to fix it. So that's that. In addition to that, the doctor wants me to go back on the Brentuximab and another drug. I think he said GMP. Can't remember the name of the second drug, but he thinks that I should go with that one because I was apprehensive about the GVD one. And he says that while Brentuximab does have the neuropathy as a side effect, all drugs will have side effects and some toxicity, so I'm not going to be able to get around that. And just from my own experience, out of all the treatments that I've had, ABVD, ICE, and Brentuximab have been the least symptomatic, or the least symptomatic for me, other than the neuropathy. I can't say that there have been some really serious side effects or really debilitating side effects. And so, according to him, I should start taking that again and couple it with another drug and do a couple of treatments, a couple of cycles of that, and then go to radiation, and from radiation plan to do a transplant. And so because I've had 15 months or so into this, and especially about a good 8 to 9 months of running around in a circle, I am not really excited about or hopeful that things will happen like that. And I'm mature enough to know that things doesn't always go the way we planned. But because there's so many questions and so many things that doesn't make sense to me from the past, it's kind of hard for me to hold on to that being a factor at this point. And yeah, I'm really blown away. I think today's response to one of my last conversations with the previous doctor, after hearing the new doctor just totally dispel that, it's pretty alarming. And what do I do about it? I don't even know what to do about it. So that's just another one of those things when you're quiet and not assertive, or perhaps too trusting, or not able to advocate for yourself, or strong enough to deal with the reality of a disease, as well as being able to communicate and be strong enough to speak up when something doesn't feel right, or take on the responsibility of making sure that my care is the best care and the most appropriate care for my case. And while that is a lot of responsibility, it ultimately is my responsibility. And even though sometimes I have completely checked out during meetings or appointments after hearing news or whatever the case may be, it's still my responsibility to figure it out and talk it out and whatever it is that I need to do. So I'm going to end this. I thought I was going to talk about a couple of other things, but I'm actually feeling a little sour. And yeah, I think I want to end this right now. So until next time, enjoy. Thanks.